Good afternoon. It's a pleasure to welcome you to this webinar, Sharing is Caring, Exchanging Knowledge on Asthma Care. I'm Armando Ruiz. I'm the Vice President of EFA. EFA is the European Federation of Allergy and Airways Disease Patients Associations. And I'm also leading the international area of FENAR, the Spanish Federation of Allergy and Airways Disease Patients Associations. We want to discuss the importance of health literacy to tackle health inequalities for asthma patients in Europe and globally. To do that, we need to understand the challenges that asthma patients face to access reliable information and really to improve their knowledge and disease management. We come together today as a part not only of a dynamic European patient community, but as a global community. For this reason, we organized this session with GAAPP, the Global Allergy and Asthma Patient Platform. As you probably know, in Europe, about 30 million children and adults less than 45 years old have asthma. And we know the impact of asthma in the health, but also in the daily life. We also know that asthma control remains poor in Europe and across the world. On top, we have, there are great inequalities. But despite the interest of patients for self-management, their knowledge of the disease remains low. Today, we have a great panel of patients and healthcare professionals talking about the difference in access to educational resources and asthma care. And we will reflect also on the importance of increasing the knowledge of the disease. We also present a new resource for asthma patients and caregivers developed by EFA and in collaboration with GAAPP. The purpose of is to empower asthma patients and their families to enable them to take actions and to be active, one active role in the management of the asthma. This new patients hub should serve really to better engage of individuals and asthma patients communities, health advocates, but also we want to build better partnerships with healthcare providers. We would like to thank Ellen Redel, the chair of scientific committee of GINA, the Global Initiative for Asthma, for her great support in the review of our new asthma patient resource, and the chair of GINA, Arthur Jorgansioglu, sorry, for her spirit in collaborating really with patient organizations. I'm sure that you will enjoy this session, and I hope really that together we can help empower our patients. Welcome, and thank you very much. I give the voice to Susanna.
Thank you. My name is Susanna Palkonen, and I am director of EFA. And EFA represents the voice of allergy, asthma, and COPD patients in Europe. Today, I will be the co-moderator of this webinar. My co-moderator will be Tonia Winders, President and CEO of GAAPP, the Global Allergy and Airways Patients Platform. And we are still waiting for Tonia to join. You know, we are in a live webinar, anything can happen. So we will welcome Tonia later on. But today, let's change the future of asthma care and self-management, patients and healthcare professionals together. That starts today. Dear participants, you will have the opportunity to ask questions to our panelists. Just scan the QR code that you will see on the screen and ask your questions. Our amazing and diverse panel will do their best to answer to all of your questions live. The questions we won't be able to answer live, they will be answered later on and published in the About Asthma website that Armando mentioned. This webinar is broadcast through YouTube and Facebook. In case you are watching, if you are facing technical problems, please use the chat of the channel you are watching this webinar on and leave your comment, because our colleagues are monitoring and they will support you. Before starting the roundtable discussion with our panel, we would like to hear from you. Scan the QR code and tell us using just one or two words, what would you change to improve the communication and partnership between asthma patients and doctors? Please do it now. Information, knowledge, time, time. That is very interesting. Is there anything else that you would like to change? Clearly, we need to change the information gap between patients and doctors. We need to have more time as patients with our doctors. But our doctors also need more time with us. We need earlier diagnosis. We need trust. We need open discussion. We need communication. We need knowledge about asthma on both sides. We need a patient-centric approach. Ongoing support for patients to manage every day with their asthma. And we need to improve the quality of communication. Thank you very much. We have some takeaways from you now, dear audience, for our panel. Now I would like to start welcoming the panel on the screen. So first, I would like to introduce Professor Fodor Popov, known as Ted. He graduated in medicine at the Medical University in Sofia, and he had his PhD thesis on airways responsiveness and cough in 1991. He has a lot of interest areas, which include asthma diagnosis and treatment, but also allergic rhinitis and so on. They are impossible to list all. He is an ambassador of the Global Initiative for Asthma, GINA. He's former president of the World Asthma Association, Interasthma, and many more connected to scientific societies. And he is an old friend of EFA. Now, I would like to welcome Ugo Navangoro. He is the founder of Asthma Relief Campaign Project, Asthma GAAPP in Nigeria, and he founded this initiative association in 2001. He has a degree in sociology and postgraduate degree in health, safety, and environmental management. Ugo comes from an asthma family background. He, in fact, lost 2 siblings to asthma, and also his father from complications arising from an intravenous injection. Thank you for sharing that with us, Ugo. Ugo is also one of the leaders in GAAPP. Now, it's my pleasure to welcome to the panel Anton Basenko. Anton is Ukrainian and he lives in Belgium since 2021. He is a globally known public health advocate and human rights activist. He joined EFA a couple of weeks ago as our community engagement manager, and he wants to invest all his experience as a patient and as an expert into capacity building and raising the voices and visibility of EFA communities. Anton's motto is "Our lives matter," and patients and community mobilization are what he has been doing over the last 15 years. So, Anton, you are an asthma patient originating from Ukraine, and you have lived in Belgium for a while now. You have a rich experience on access to asthma care in Europe as EFA community manager. Could you tell us how patients access diagnosis and asthma care? Actually, in your view, what is most important in access to proper information about asthma? Also, we would like to hear how the war in your country and the emergency context has impacted care for asthma. Are patients properly informed about how to continue with their asthma care? Anton.
Hello, everyone. Hello, Susanna. First of all, thanks for having me here, an opportunity to raise the voice of European patients, patients living with asthma. Just for the beginning, I give some geographical context. I'm from Ukraine, as Susanna mentioned, a country with almost 213,000 of people living with asthma, from which around 38,000 are children. And this is official data from Ministry of Health from 2017. There is no more fresh data, unfortunately, the latest which I could find. It's the country where health reform is still happening since 2015. And it's the country where war, unfortunately, happening already second. Ukraine is a lower middle income country, as well as absolute majority of the countries in Eastern European Central Asian region. And as we know from WHO, only in the half of those countries, when we are talking about inhalers, access to inhalers, which is the key medicine for asthma people, only in half of such countries, asthma patients have access to bronchodilators, and only in 1/3 of those countries, patients have access to steroid inhalers. A bit about myself. I've been suffering from obstructive bronchitis since very young age and got my first lung inflammation when I was 4. So asthma officially been diagnosed at 12, and at 16 I got removal of chondroma from my lung, and finally been diagnosed also with COPD. So as you can see, I'm the one who shouldn't even try to smoke cigarettes, but in fact I started smoking in a very young age, since 10 or 11, and smoked for 22 years. Of course, I kept suffering from this spasm all these years until I quit smoking in 2013. What is also important to say that I'm a person openly living with HIV, and later you will understand why it is important in the context of this conversation. So, situation and access to asthma care in Ukraine is not easy. Unfortunately, due to the health reform, differentiation of primary, secondary, tertiary health level of services, we came to a reality when patients' first step, of course, should be done only through general practitioner, make appointment, wait for this appointment, come to GP, tell him first all your issues, but GP has not legal right to diagnose asthma or COPD, for instance, and you will be referred to pulmonologist. On the way to pulmonologist, we know that we already lose a number of patients. Also, when it comes to things like allergies, I'm from Kiev originally. In Kiev, there is, and even in Ukraine, there is one big Republican allergic center, and it stays in the very opposite end of the place where I live, for instance. So for all my life, no matter how many times the issues of defining the allergies were raised, it was so complicated to go there and to spend there, I don't know, days or weeks for proper, testing and diagnosing all your allergies, and it's a big issue for people, especially from other regions of Ukraine. So this is also a reality. Good news is that in 2021, Ukraine adopted new clinical guideline on asthma, especially for asthma for kids. According to official data on National Health Service of Ukraine, there are 33 medicines for diseases for lower respiratory tract, including asthma. 20 trained names are fully free of charge, and 30 meds with the co-payment. But in fact, so this is the ideal picture. But in fact, due to supply issues, quality of drugs, patients reporting either that they don't have access at all in their regions, or drugs are kind of bad quality or not suitable for them, and they don't want to take this free of charge. They prefer they're rather forced to pay their own funds and to buy something which is not covered by this program. As they say, I feel some patient reported that I feel myself better without medication. So situation for kids patients are the same, and very specific situations for regions close to the front line where the war is happening, occupied or deoccupied regions, because supply chains were broken. And unfortunately, people to get access to inhalers must call or request some charitable funds to help with access to medication. And it's not only about this type of medications, but this is the reality of the emergency context. And when it's coming to very specific groups of people, like, I don't know, for instance, people living with HIV, people who use drugs, homeless people, poor people, it's also a question of stigma in general in access to healthcare system, and when it's coming to specific diagnoses like asthma and access to medication. If we come to Belgium, of course, it's a high level income country. Of course, you are in one or another way your medication and services will be covered, with no matter whether it's a social service or insurance. But I would like to focus on the specific issue for people like me, like, I don't know whether it's work migrants or refugees from Ukraine, and especially in sense of access to information, and because it's mostly language barrier, and you don't know where to find properly the information, where you should go, how it should be proceeded, etc. So if we go back to Ukraine, talking about information, there is unfortunately no one centralized resource where you can find information about us. Very limited pieces of information on the Public Health Center website or Ministry of Health website, but it's mostly this either very brief explanation what is asthma and symptoms, or some kind of official data, as you could see, not very fresh one. Or it's a website of private clinics, with also very limited pieces of information, and the forum, of course, kind of trying, it's more like advertisement and trying to motivate people to buy services in this private clinic. So sure, first and the most trusted resource of the information for a patient is doctor, but in Ukrainian reality, especially after health reform, especially when it's general practitioner, they are really overwhelmed and busy with a number of patients and number of diseases and pathologies they have to deal with. And sometimes they don't have elementary time for you to answer properly all your questions. Or sometimes patient does not understand what kind of information he needs, he should ask. So that is why, just to summarize my answer, I think it's first of all, it should be one unified resource of information. But when we're talking about information, we understand that it also depends on the type of the person who is seeking this information, whether it's a common patient or it's a patient activist who can use this information for certain, I don't know, advocacy, or it's a medical doctor, or it's a health manager for some kind of using this information for decision making. So of course, ideally, this resource should be united or equally accessible for all these categories of people. And of course, language barrier should be also resolved. Thank you.
Thank you very much, Anton. Now, let's see what happens outside Europe. Ugo, we heard from Anton from the European perspective, and specifically about Belgium and being a foreigner, and Ukrainian perspective. We realize that asthma health outcomes for patients are clearly linked to the national healthcare systems and the political and the legal contexts, and it varies from country to country. As an asthma activist from Nigeria, could you explain to us what is the reality of access to asthma care in Western Africa? And what kind of inequalities do you experience when comparing the situation with the other regions? And do those inequalities that you experience, do they relate to the access to information on asthma in Nigeria?
Okay, thank you so much for this opportunity and privilege. In fact, I am excited, and I want to believe that, you know, if there are Africans who are, you know, watching or participating, they'll be excited too, because I think that this is the first time, I would say, you know, that, you know, patient-related matters are being, in Africa, you know, are being given this kind of highlight. And that's what we have been trying to achieve for a very long time. So with what is happening today, you know, we are excited that there could be some quality information now that asthma patients in all these Western regions, you know, and some other parts of Africa could have access to. I would like to start by saying that one of the problems, you know, that, you know, most developed countries have gone through, you know, decades ago are what we in Africa, and particularly the Western region, as I want to, you know, particularly, you know, focus on, are still trying to grapple with. When you talk about asthma, up till today, there is so much underreporting about, you know, asthma and asthma-related, you know, matters in these countries. And there is misinformation. And there is stigmatization on these asthma, you know, patients. And the patients have been made to feel that if you are experiencing, you know, the asthma disorder, that is one type of a weird disorder, health disorder, that you don't have to expose and let people know that you have it. That's why when I lost my junior ones to asthma, and actually what triggered it was when my dad, who was equally asthmatic, went to the hospital, and you know, a nurse was trying to give him an injection, and you know, aminophylline injection, and didn't know that you have to give it gradually, and you know, just pushed in, you know, the injection at that time, and he had a heart seizure, and that was how he died right there, you know, just because he was at the hospital and he had, you know, breathing problems. And the truth about it is that it had been checkmate, but they said, okay, let's make it better. So all these things are complications. Diagnosis is there. Diagnosis. For most people that have asthma, even when you go to the hospitals, they don't have proper equipment to diagnose. So when all these things are put together, when I lost my dad, I said, no, there must be some information about asthma. There must be something. And that was when I started making, going through researches. And during my periods of research, I came to find out that, the asthma disorder, it's not, something that is weird or something that you have been sentenced to death, and that there is a way out, that patients can actually manage themselves. And there is a first aid that is available to most people that die carelessly from asthma. I now said, okay, so I called some people together and we started that campaign, to educate patients. Before then, there is nothing that has ever been, brought up, in respect of asthma patients. Now, when we came up, that was when we started having the bottlenecks. You see, you need funds to go around to teach, to educate the patients. We did a survey to find out one of the most common first aid things that you can say can save an asthma patient, which is the inhaler. You find out the majority of the people don't know how to use inhaler. And when you ask them to practice it before you, you see that they don't know how to use it. And all these things are included in the leaflets that are contained in these inhalers. So we now said, okay, this is one of the things that we have to do. We started going from school to school, from community to community, and we had our limit because that was when we found out, when we started requesting for partnerships, we found out that even the government of our country, just like most other Western region countries in West Africa, do not have asthma, have not identified it as a national health problem. But like in Nigeria, we're talking about, they're saying about 20 million people who have asthma. And you find out that your close friend could be asthmatic, but you may not know because of the stigmatization which is there, and all manner of stories about witchcraft and things like that, that it complicated the matters. All right, so I want to say that right now, one of the problems that we have always had is funding. At the time that we were engaged in this practice of teaching the patients, on what asthma is. Asthma is not a death sentence. An asthma patient can live up to 100 years or above. You can lead an active life. We're trying to teach people because of what we had learned. And what we had learned, we gathered from the Western, developed countries. We had partnerships with some organizations, that, through their websites, we had information, and sometimes we write to them and they give us some books. And we had a very strong partnership with Gina. Gina gave us the right to republish some of those books in Nigeria. And we started. We published some of the ones for, the students, because Gina has, something like that, for patients who are not very educated. We did that, and then we did the standard one. And we even went ahead to publish the one for medical practitioners, because there was lack of education and understanding, even amongst, the medical health practitioners. You will attend to an asthma patient and you will not tell an asthma patient how to use an inhaler. And you prescribe drugs and he goes home and does not know that this is how to use the inhaler. So we had some sessions for asthma, for the medical doctors, and pharmacists, where we brought in medical experts to train them, based on GINA guidelines. Those were some of the things we were trying to do. But somewhere along the line, we had our limitations. We needed sponsoring organizations, but that was when we were made to understand that this asthma has not been recognized by the government as a national health problem. So most sponsoring organizations sponsor the areas of health that have been identified by the government. We were astonished at that, and that has remained the issue till now. So with what we felt that there is so much inequalities, like what Anton just talked about now, that there has been, a kind of a clinical inclusion into their health, streamline, in Ukraine. But you find out that there is nothing like that here. So what has come now is with the partnership and the support that we're having from, GAAPP, and the, relationship now with EFA and the rest, we are sure that we can now begin to put pressure on the government to do the right thing, so that asthma patients, yes, will have a lease of life for the first time. Thank you so much. I have so much to say, but I'm restricted by time. Thank you so much.
Thank you very much, Ugo, and you will have more time later during the discussions. Yes. Thank you for that striking and very clear reality that you're living. So now, Professor Popov said, we just heard from the patient's perspective from different parts of the globe. Patients consider healthcare professionals as a key source, probably the main source of information about asthma and their health related to asthma. From your experience, how do you build information bridges with your patients? And how can medical doctors help patients to get educated?
Thank you, Susanna. Thank you for the opportunity to share my thoughts on that. I'm coming from Bulgaria, which is a southeastern country, not far away from Ukraine, by the way. Mm-hmm. And it's not about the country that I'll be talking about, because it's a member of the European Union and it's sort of connected with the system of healthcare of the Union itself. I'll pick on two words, and one word is awareness, which is exactly what we need in order to find out who has asthma and who hasn't got asthma, or who has some other diseases that mimic asthma. And once you state the right diagnosis, then you are on the right track to prescribe the proper management of the problem and make it personalized for the patient that you are treated. Second thing is harmonization. I'm very glad that we saw Ugo's point of view on asthma in Nigeria. And certainly it's telling us that what we perceive as European asthma is certainly different in the different parts of the world. Mm-hmm. And there should be some way of putting together the different, what we know in different countries about asthma in a structured way that will make us assume the proper approach to the patient and to the group of patients that belong to the same phenotype or endotype of asthma. But let's not make it too complicated at this point. I just want to give you an example from epidemiology of asthma. Somewhere in the middle of the last century, an attempt was made to assess the prevalence of asthma in a rural region of China. And as you can imagine, it was a huge number of subjects that were questioned about having asthma. As it turned out, it was a bit of disappointment because most patients didn't answer that they had any symptoms of asthma, wheezing in particular, or anything else that has to be considered asthma-like. So the prevalence turned out to be 0.00 and something. And it turns out later on that it was a matter of awareness. There was even not a hieroglyph for asthma in Chinese that was well accepted there. A couple of decades after that, a similar study and survey pointed out that the prevalence of asthma in China and in the rural regions is very similar to what we have worldwide. In this way, I just want to point out that having awareness among the general population, among the different countries, on the globe, it has to be somehow spread around and disseminated in a way that it will be recognizable by everyone. And this is the purpose now. I'm coming back to my GINA sort of representation, as I'm advocate of GINA, and I'm trying actually to spread the notions about asthma, and this appeal is to harmonize knowledge and to harmonize management of asthma. So GINA is doing exactly that. It's sorting out all the new papers that come in asthma. It picks up the most important common topics and well-verified facts in asthma management and diagnosis. And then we have to spread those messages all around the globe. And this is something that should be going on along a network that GINA actually is leading. And different advocates of asthma, there are 41 around the globe, they have this exact mission in life to spread the knowledge, to spread the important things, and they have to spread it among doctors, among general doctors, among specialists, and among the patients, using organizations like EFA and like GAAPP. So we have to stick to those important conclusions that have been reached and highlighted by the GINA Science Committee and by the GINA publications in general. There are very different publications for all different layers of the general public. And I strongly believe that this is the way to go ahead with having a uniform perception of what asthma is. A person who is first time told that he has asthma is usually shocked, and he panics, and he thinks that this is the end of the world for him or her. And this should be changed. People have to live with their asthma, have to get used to their asthma, and have some bright prospects of improving their asthma and having a healthy quality of life. So that's what I wanted to share shortly with you. And I hope this message is something that can be true for anyone that's listening and watching. Thank you.
Thank you very much, Professor Popov. We heard now from our panel members very rich and diverse perspectives about asthma care and access to educational sources. And we can conclude that there is great inequalities, and these are related to awareness, diagnosis, access to information, and also stigma, as highlighted by Ugo. We have some quick question to all of you, dear panelists. Please be extremely short so that we can move to the next session. What do you think is the most critical issue to improve health literacy among asthma patients and carers? What would you change to improve the patients and doctors' relationships to increase asthma literacy? and I will start with you, Anton. Please be brief.
I will be really brief. I think we can see few sides of this question. So talking about like health literacy, or again information or proper education, of course, it's always should be about very clear, affordable, up-to-date information. And I think the key issue is the promotion of health tools. Make it really popular and attractive solutions. We can propose really simple and kind of easygoing formats. Also can be different, you know, school of patients, applications, etc., etc. Of course, talking about patient-doctor collaboration, it should be mutually interested for both sides. So, of course, we have experience of patient-doctor joint trainings, thematic trainings, which also works well. But for me, as a community engagement manager, I think in all this like bigger picture, the key requirement or key need is meaningful engagement of patients and patients' voice into decision-making processes related to their health, and into actually development of educational programs, or I don't know, service or treatment or care programs for them. So it can be working groups under the Ministry of Health, it can be community advisory panels, it can be inclusion of patients into oversight committee of certain healthcare facilities. Formats in different countries are different, but patients' voice should be there. You develop guideline, you develop, I don't know, educational program, there should be a representative of patients' organizations and patients' voice. That's a must, key for me. Thanks.
Thank you, Anton. Ugo, what is the most critical issue to improve health literacy among asthma patients and carers, in your opinion?
Okay, I would like to say that at this moment, just quite briefly, one of the core things that I want to advocate will be a situation where the government play, you know, a better role than what they are doing now.
Mm-hmm.
You know, basically, most of the governments should be able to, you know, include asthma and probably other lung diseases that are related to asthma into their different health policies, and then try to develop a guideline for management. If that is done, that will now translate and, you know, give rise to, give rise to the importance of training, education and training of the doctors, so that, and the other medical professionals, so that they will be able to understand what asthma is. It's not, we wouldn't want to just blanket and say that all medical professionals know, you know, the deep things, you know, about asthma. They need workshops, regular workshops. Tina has outlined some of these things. They have publications in respect of this. When the government is able to do what they are supposed to do, then all this literature can be put together and sponsored by government and other stakeholders, and train some of these professionals appropriately, equipping them with enough information for the patients. You see, when they are properly equipped with information, it will automatically, you know, transcend to, you know, the patients. And then there should be a deliberate patient education, trying to tell them, especially some of them that, you know, think about, you know, a witchcraft and things like that, that it's not, or they've been sentenced to death, and then giving asthma different types of, you know, names, you know, misconceptions. So by relative education, definitely they and the doctors and the government will get into a partnership that definitely will work. The three of them have roles to play, but the government should initiate it, and the doctors will translate it down to the patients. Thank you so much.
Thank you very much, Ugo. Ted, briefly, very briefly.
Dissemination should go down the network. There should be a special transmission to the patients, and EFA has the most important role here, and GAAPP as well. And we should use traditional and contemporary information technology methods. And as the area is very dynamic and it's evolving very quickly, perhaps the traditional methods will give way to the contemporary immune technology methods. So that's what we have to make sure, that we're using the appropriate ways to bring down the information from the leaders to the sufferers. Thank you.
Thank you very much. And thank you to all of you, Anton, Ugo, and Ted, for your precise and strong messages on asthma, health literacy, and inequalities, and most of all, what we can do about it. We will come back to you later on. Dear participants, ask your questions on Slido. And while you are doing that, we will move to the next session. The aboutasthma.org website is a guide for asthma patients and carers. It provides general information on educational purposes only. It is mainly targeted for asthma patients and carers, and it was launched on the 25th of September to mark the World Lung Day. Aboutasthma.org is part of the project run by EFA in collaboration with GAAPP, and it is purposed to provide a reliable source of information about asthma management and prevention for patients, carers, and patient associations. The topics and the key questions on the website have been chosen after discussion within patient groups to understand what are the main aspects and the many aspects of asthma that affect most patients' lives. As you will see on the video that will be played next, aboutasthma.org is inspired by the latest science. It is nothing revolutionary, but it is the basics, and it is shared. It provides information and tips to patients and carers around 5 areas: asthma symptoms, asthma attacks, asthma care, life with asthma, and help for asthma. Let's watch the presentation. The aboutasthma.org logo, it shows the narrowing of the airways, and we will be further building on this design to better explain what asthma does in the lungs. The website will soon be translated in several languages in collaboration with our asthma patient organizations community. They are, in fact, the reference for asthma patients and their families in their communities. The website will be updated on an annual basis to reflect the latest research findings in asthma. It is also open for scientific input and patient feedback about asthma through a contact form. Please keep this website as a reference source of information to guide patients preparing for a consultation, checking the meaning of one of the terms in the glossary included in the website, or for improving the care for a family member with asthma. Also, if you know, and I'm sure you do, other quality information about asthma, especially in other languages, please share it with EFA to include as a resource on the website. Remember, aboutasthma.org. Now we will move to the Q&A session with our speakers. Now the floor is again open. Please use the QR code to access the platform and write your questions. I also invite to like other participants' questions because the most voted questions will be asked to our panelists. Okay. Okay. Can I get back on the screen the first question, please? How to understand asthma medication and devices and how they work? How to translate complicated terms and phrases in everyday patients' lives? I would like to ask this question from Ted. What do you think?
Yes, Susanna, this is a crucial question. And it was echoed by Hugo when he talked about his environment. It's very complicated, all the more there are newer devices for inhalation, and inhalation, the route of administration is not like taking in a pill. There are different devices, different ways of choosing the device, different ways of making sure that the effect is there. So we can't say that in a few words. Each subject who has to deal with the inhalation of the drugs will have to check with the specialist who is in the region in order to find out which is the best device suiting his needs or her needs.
Thank you very much, Ted. Can we have the next question? Okay, and this is critical. How patients can trust the information on the web? Let's start with Anton.
Well, it's an interesting question because, you know, in nowadays, in this reality, in the web, of course, it's always a question of like, where is this information coming from? But I think that is exactly where patients organizations like EFA, GAAPP, or other trusted organizations, if you can see, if you can see the logo, or if you see that this product is kind of organizations like EFA, GAAPP, I think that should be a sign of it's a very subjective thing, of course, trust information in there, because in fact, you never know.
Thank you very much, Anton. Can patient organizations be formal mediator, communicator, or translator between a patient and a doctor? Would you like to take this, Ugo?
Can I have the question again?
Yes. Can patient organizations be formal mediator, communicator, or translator between patient and a doctor?
Well, I would say yes. Yes, in the sense that patient organizations just like GAAPP, EFA, and let me bring it down to even Asthma Relief Campaign project. That's what we have been doing. We have been trying to bridge the gap. You see, we organized programs, workshops where, you know, pharmacists and medical doctors were invited and experts had to train them. And on the other hand, we are equally having sessions and educational awareness programs for asthma patients directly, trying to get the information that is relevant for them, to let them know, to tell them when they should see a doctor, to tell them what they should do before they meet a doctor. So the patient organization's role is very key, very, very key. And that's why what you're seeing now, there is a website that has just come out now. It's the product of a patient organization. And it will benefit both the patients and it will benefit most of the doctors. I want to believe that there'll be a forum there where patients can ask questions and medical experts on that forum will answer them. Thank you so much.
Thank you very much, Ugo. Before we close the panel, I would like to ask some takeaway messages from all of our panel members. And I invite you to do it in one sentence. I will start with Anton. What's your takeaway message from this webinar?
I think key takeaway is that this webinar is a brilliant example of uniting efforts of patients, community, and medical community. And these efforts and this synergy should be used further for the better lives of people living with asthma.
Thank you. Ugo, what is your takeaway message?
Okay, I would like to say that this is a very beautiful opportunity, a very beautiful project that has come up, you know, by EFA, you know, talking in terms about asthma.org, where information for patients can easily, you know, be reached. I wouldn't say that this is the first time that this kind of thing is coming up, but I want to believe that as it has come and, you know, patient organizations are being brought in to participate in these programs, it is left for the patient organizations to introduce it, you know, in their various regions, like Asthma Relief. We're going to drive it, you know, deep into Nigeria and all the other West African countries. A website could be there and nobody will know about it. It is knowing about the website that matters. So we all have responsibilities to ensure that asthma patients have this opportunity and, you know, they are not ignorant about it. They get the best from it. Thank you so much.
Thank you very much, Ugo. Ted.
Harmonization is crucial, and EFA, GAAPP are the interface to achieve that goal.
Thank you very much, dear panel. You have given incredibly strong perspective on the variability and the inequalities in accessing asthma care, knowing about asthma as a patient, and in fact, knowing about asthma as healthcare providers. You have also highlighted the gaps in awareness about asthma. Asthma is not sorted, and thank you for your perspectives. And of course, it doesn't end here in this webinar, like Ugo said. Thank you very much. What's happening? We invite you all, dear participants, to use the website, and we encourage you to reach out to EFA and GAAPP and to follow us through our social media channels. We would love to hear from you. We are here for the asthma patient community and for the asthma healthcare professionals community for partnerships. Thank you to all participants, EFA's sustainable corporate partners AstraZeneca, Chiesi, and OM Pharma for your support for this project and for this webinar. Thank you to Gina, Global Initiative for Asthma, for your advice behind the scenes. It has been invaluable. We thank De Jong, AV, for the production of the webinar. We thank you, Scientific Communications, who worked with us on the website content. I thank EFA team who worked behind the scenes for making this webinar happen. Thank you to EFA board for directing this project, for GAAPP for partnerships, and we are sorry we couldn't welcome Tonya today. Best wishes, Tonya. Thank you, finally, to EFA and GAAPP members of community. This is all about asthma today.